Hi, everyone. Thank you so much for joining. Thank you for waiting. Thanks for joining us an hour later than usual. I just got into Toronto like half an hour ago, so I'm in a strange, undisclosed location with a very ugly background. And I was just telling Lisa and Mary Lou, I've propped up my laptop on my makeup bags. I've rearranged everything here. And but I'm really stoked to be here with Lisa Marchiano and Mary Lou Singleton, of course. Lisa is joining us this week because we want to talk about therapy and whether or not it's a grift. Just joking. I've done a lot of therapy in my lifetime, and some of it's been very helpful and some of it's not been helpful. So I'm sort of presuming we're somewhere in between there. But yeah, everyone who's in the live chat, thank you for being here. If you have questions or comments, I would recommend using the super chat so that I see it. I usually try to keep an eye on the live chat a little bit, but I can't really follow it very closely because otherwise I get distracted from the conversation at hand. And yeah, we're going to be back to our normal time next week, which is, so it's 9 p.m. Eastern. So we're normally here at 8 p.m. Eastern, but yeah, because of my flight, we're starting later. I have included Lisa's info and website and podcast in the show notes down below if you're watching on YouTube, as well as Mary Lou, who's on Substack, which you should subscribe to. It's great. And her website is enchantedfamilymedicine.com. And Lisa has like a brand new book out, which I'm pretty mad about because I don't have any books out. And I think you have, how many have you done now?
I have 2 books that I've written by myself and another book that I co-authored.
Okay. That's quite a lot, in my opinion. What is the new book? Can you tell us a little bit about it?
Oh, Megan, I'm so glad you asked.
Can you believe I remembered?
So my new book is called The Vital Spark. Reclaim your outlaw energies and find your feminine fire. And actually, it would be fun to talk with you about it sometime, Megan, because as we spoke about a little bit, it's not really a book about feminism, but I kind of work in this stance there that it's hard being a woman, and it's sort of like get over yourself and figure out how to advocate for yourself. Like, instead of trying to say, well, it's bad because of the patriarchy, and if this, it's like that all might be true, but if you're waiting until the patriarchy changes before you with your life, you're going to be waiting a long time. So it's based upon my own struggles, and those a very personal book, and also the women that I've worked with over the past 25 years or so since I've been a therapist. So yeah, I think it's fun too. It's a fun book.
I'm so excited to read it. This sounds awesome. As somebody who sort of became, I've always been critical of feminism in some ways, but I don't love the systemic analysis so much anymore. And I feel that young women in particular are missing that, like, how do you empower yourself?
Right.
And how do you feel good about yourself? And how do you build actual self-confidence without, blaming the patriarchy or capitalism or colonialism or whatever it is, right? I don't think those things are actually super empowering ways to empower yourself. And I know that
that's a very disempowering framing, which I think actually leads right into our topic tonight, by the way.
I think so too. So you're a therapist, but you're a Jungian therapist, which is a specific thing, correct?
Yes, it is a specific thing.
Can you tell us a little bit about that?
So I'm a Jungian analyst, which means that I have sort of basic mental health training. I'm a licensed clinical social worker, but on top of that, I went to analytic training, which takes anywhere from 5 to 8 years. If you're a Jungian, it's a pretty rigorous endeavor. And let's see, always hard to sum up, but I would say that Jung okay, so Carl Jung was a colleague of Freud's. He was born in 1875. And if you've used terms like introversion, extroversion, synchronicity, shadow, archetypes, collective unconscious, these are all ideas that Jung developed. So a lot of his thinking has kind of entered the culture. He was initially kind of a colleague of Freud's, but they parted ways over some theoretical issues, and Jung kind of got I don't know, shunted to the backwater a little bit, and Freud kind of won the day. So Jung is always, I think, there's been a kind of perennial interest in Jungian ideas in certain quarters, but it's never been particularly mainstream. And if I had to say what makes a Jungian stance unique, and perhaps particularly relevant to what we're talking about last night, is Jung felt that we're inevitably trying to grow toward wholeness, kind of unconsciously. We have a programming where, like the metaphor is in every acorn, there's the plan for an oak tree. And if things work out right, the acorn will become an oak. So we come into the world with certain things that we're meant to do or to be. And if we're relatively fortunate, we get to do most of those things. But sometimes we get blocked either by the environment or by some kind of internal conflict. And then that can result in symptoms and suffering. But it's basically a fairly non-pathologizing way of looking at psychological distress. So it's not that Jung didn't see a place for, what we would think of as kind of mental illness, but it's more like, if you're suffering, what's the meaning of that suffering, and how might that relate to your feeling blocked, I would say.
I have like a long list of questions, but I want to go to Mary Lou, so that I don't dominate. Mary Lou, like, what's your experience with therapy been? I'm curious.
Personally, I'm somebody who's benefited from therapy. I had a really hard adolescence and had a life-threatening eating disorder. I didn't get along with my mother. I'd never bonded with my mom because of some crazy birth stuff and being the middle of Irish triplets, just like I just never really connected with my mom. And I was a feminist Jungian therapist who really saved my life in high school. My parents had first sought psychiatric care for me, and that, like, I was on a lot of drugs. I was really miserable. I was in inpatient psychiatric care, and it was just getting worse and worse. And finally, my parents kind of saw through that of how it wasn't helping. It wasn't making anything better. And even though they were very staunch right-wing Catholics, they found this feminist Jungian therapist who would drop me off at her house every week. And she introduced me to Marion Woodman's work, which just really blew my mind. She's a famous Jungian author. I read The Pregnant Virgin. I learned to view my life as I'm living my personal myth, how like this is my mythic story, and what is the metaphor behind my symptomology, why, kind of viewing the eating disorder as, pathological performance art kind of, and trying to find better ways to express myself. And so, I really benefited from that form of therapy. And I really owe a lot to my therapist when I was, she really saved my life in high school. What I see now, is a difference in the therapeutic model. I think that it used to be a kind of an edgy, stigmatized field, and it attracted a lot of more outlaw people, people who weren't mainstream, like midwifery, like so many other things. It's become this kind conveyor belt standardized process to a certification that leads to a job where you can take insurance. And I do think therapists are different than they used to be. And I can't find Jungian therapists for my patients. All I can find is people who practice a model of believing all of our behavior and thoughts are a result of brain chemistry, and that I'm constantly having patients come and tell me their therapist told them they need to be on medication for their chemical imbalance. And I think it's interesting. I'd love to know what Jung would say about what we're expressing in that cultural pathology that's going on right now.
No, that's a great story, Mary Lou. I didn't know that about you. And that's such a great question that you just ended with, because in some ways, the way we're responding to mental distress now, we're like, oh, well, you need to be on medication, or you need to, put your self-diagnosis in your social media bio. It's like, that is a symptom that's telling us something about the culture. It's like a collective symptom. And we could use that to kind of understand, like you're saying, kind of as a metaphor for the culture.
Mm-hmm.
I think that it's interesting, because I think that what you would assume is that a culture that is doing a lot more therapy, which I think it seems like, at least every woman that I know has been to therapy. I know there's that meme that goes around all the time that's like, men will do blank except therapy. But I also know men who are going to therapy as well. And I think that's a pretty new modern thing. But I also I wonder if it's helping, like I think that there are probably specific kinds of therapy that can help. And then like, okay, so for me, for example, like I've done a lot of therapy in my life. I've seen a number of therapists, and one of them was really helpful in terms of, I was leaving a relationship with a man who was like a really serious addict, and that really can mess with your head. I didn't know anything about addiction at the time. This was, when I was like in my late 20s. I didn't really understand what was going on. Like for a long time in the relationship, I didn't even know that there was this addiction. I was just really confused about, why he was disappearing or like acting weird. And we did cognitive behavioral therapy, and I found that really helpful because I was having a lot of anxiety and overthinking and obsessing, and it helped me get out of that and move forward. But at the same time, like I saw a lot of therapists that were, I don't know, I guess kind of useless. And I was really lucky that I ended up finding that one. But I think I know a lot of people who sort of get turned off of therapy because they go see a therapist and they're like, okay, like you're not giving me any new information. You're not offering me anything helpful.
So I'm curious, like what in your opinion made one therapist useless versus the other therapist helpful? What was the difference?
Either they were too nice to me and I felt like they liked me too much and they wanted to be my friend.
Yes.
I mean, of course.
Yes. And who wouldn't want to be your friend, Megan, really?
But, like I just that they were like agreeing with me too much. And I was well, I could just do this by myself then.
Yeah.
Or that they just gave me really basic kind of textbook responses. Like I remember seeing a guy, I guess he would have been a counselor. I'm not sure. Is there a difference between a therapist and a counselor?
I mean, that's like a whole thing, and it depends on what country you're in, but no, not really.
And I was leaving. This is going to make me sound like I've had a horrible life, but I haven't had a horrible life. I was leaving an abusive relationship with a man. This is when I was probably around 26. It's quite a long time ago. And so I thought, I should see a therapist. And obviously that was really stressful. I was having a lot of anxiety around that. And, I felt like he kind of just opened up a binder and he was like, well, clearly you need to learn how to be more assertive. And I was like, I don't think I do need to learn how. That's not what my problem is, right? It's like, like he sort of had this idea or he'd been taught that, an abusive relationship is like this. There's like a domineering man and a passive woman, and you need to learn how to stand up for yourself and, say no and I mean, it was so unhelpful and so stupid. And I remember, I mean, gosh, I've been to more therapists than I even remember. I've been to therapists, like I've been to couples counseling and felt like the man managed to manipulate the therapist and dominate the conversation and sort of gaslight me in therapy. And that was horrible. Like all sorts of stuff like that. Stuff like where I just felt like you don't get it and you're not helping. And in some ways you're maybe even making this worse. So I mean, I guess, therapists are human. So there's good therapists and there's bad therapists. But I guess I wonder if this sort of overriding universal advice that's being offered, which is like, you need to go to therapy and that's going to fix your problems. I mean, it's not really true, I suppose.
I definitely don't think it's true. I say all the time, I'm not a person who believes that everyone should be in therapy. I think it's, it's probably right for many people at some point, but not everyone. And, there's certain problems that can be helped in therapy. And there's certain kinds of people who would do well in therapy. And then there's other people that it's probably not the right thing for. And they would probably be better off buying a pair of running shoes and starting to exercise or whatever. And there are good therapists and there's bad therapists, and also there are good for you therapists, but maybe bad for someone else. I don't think that I would be a good therapist for there are many people for whom I would not be the right therapist. Many people, and the trick is, sort of finding the therapist who really feels like a fit.
Mm-hmm.
Yeah.
Well, I think that what you just said is so important, that interpersonal alchemy and that therapeutic relationship is what heals, right? Whatever kind of healthcare we're talking about. And now we have this system where therapists are considered fungible commodities in a big mental health practice. And you call, you get an appointment with any random person because they have these letters after their name, they're qualified to see you. And I think because of that, very few people are getting that alchemical connection that's so important.
Yeah, well, and I mean, the unfortunate reality is that therapy is very expensive. So I think for a lot of people who don't have coverage, it's hard to shop around and find the right one. But I do agree with you. Like, it's not that easy to find the right fit as far as a therapist goes. I think one of the issues I would say that I had with some therapists, and I think that I get the sense this might be common. Like I don't necessarily want to be validated. Like I feel like therapy can be way overly validated. I think validating. I think we can see that in a number of ways, but I'm not necessarily personally in therapy for my experiences all to be validated and to be agreed with. And I wonder how helpful that is for someone who, like a man who, like I'm wondering what would happen if a man who was abusive, for example, went to therapy, a man who was an alcoholic, a man who was a narcissist or something like that. And we're like, go to therapy, this will help. But, will it help? I mean, how able are therapists to hold their clients accountable, and how much do they do that, I suppose, is one of the questions that I have.
Yeah, it's a good question. Well, first of all, I just want to share Dr. David Bell, who's a psychoanalyst in the UK. He was with the Tavistock until he left.
Yeah.
He says, I've heard him say that a therapist is someone who's on your side, who doesn't always side with you. And really the purpose of therapy, as I understand it, is to increase insight about your unconscious motivations and conflicts so that you can make more conscious decisions. So that does require a certain amount of confrontation. And then the next part of the question that you slid into, Megan, is super, super tricky, because the first thing that we do as therapists is you align with the client. So you want to develop a rapport. And it's not even just that you want to develop a rapport. You certainly want to do that, but you also want to try to kind of enter the patient's subjective experience a little bit. So when someone comes in and sits down and starts telling me, there's a little bit of a sort of suspension of disbelief that I'm sitting with when I'm hearing a story, where I'm going to tend to try to believe them. So maybe they're psychotic and they're telling me some really strange things. I'm going to kind of try to just put over here the part of my mind that's going, oh, that doesn't sound right, because I just want to see if I can meet the person where they are, right? And so I think that this is necessary, but I know it gets us into trouble too, because you're going to tend to side with your client. You're going to tend to see their world through their eyes, of course. If someone comes in and is kind of constantly telling you, I don't know, how terrible his wife is, I mean, it's pretty hard to peer through the weeds and see that he might be exaggerating, or he might actually be outright lying, or there might be another side of this. Maybe it's perfectly honest, but there's just another side of the story. It is very difficult to really get a handle on that. And so I think we are always in danger of it's hard to challenge. Here's the thing. It's very difficult to challenge someone about what's going on in their life outside the consulting room, because you actually don't know. Unless they tell you, or unless they reveal to you something that you can pick up and catch and reflect back to them. What can happen is that you can confront the person in your relationship. So if the person, for example, is very narcissistic, or there's psychopathy or something like that, it'll show up in how he or she treats you. And then it's very important that the therapist confront that. So whatever pattern, I mean, one of the ways that therapy is supposed to work is whatever patterns are going out there in our lives, we'll bring into the consulting room. And then, ideally, that's great, because you can look at it together, and the therapist is actually going to tell you, this is what you did. Here was my reaction. This is what came up for me. The therapist is not going to lie or just avoid you, hopefully. But it's true that a lot of therapists are conflict avoidant and prefer harmony, especially, I'm going to say it, especially female therapists. And so you can get into this dynamic where either the therapist just sort of nods along, or maybe is horrified, but doesn't have the skills to make the necessary confrontation.
The narcissism one I'm interested in. I know a man who I consider to be a narcissist, who he went to therapy, and when I told him he was a narcissist, he was like, I'm not a narcissist. I asked my therapist, and my therapist said I wasn't a narcissist. It's like, oh, well then. I doubt that. I'm not sure that's the therapist's fault. Who knows? Narcissists are probably tricky to
yes,
treat.
Mm-hmm. Yes. Yeah. And there's one of the kind of truisms is that don't send a sociopath to therapy, because the person will become a better sociopath.
Right.
Mm-hmm.
I know. Yeah, I think that's true.
I read this case study of sociopathic children. It was just horrific, and these kids doing terrible things. Like, one was every day shaving off a little more of the cat's tail to see if anyone would notice. Another had killed another child, and the state they lived in had set up a summer camp for children who were sociopaths, and they all got worse. Like they honed their skills around each other.
Yeah.
So it's sociopathy is a very difficult thing to address, especially in minors.
But that the thing that you just mentioned, though, that has a name, it's called deviance training. And that's why when you have an eating disorder and you go to the eating disorder clinic, you usually come out, maybe you come out better, but you also come out with a lot more knowledge
Mm-hmm.
about how to be an anorexic.
Oh, totally. Yeah.
You go on to the psych ward, and you come out with often with more symptoms because we're all suggestible.
Mm-hmm.
And the DSM, the Diagnostic and Statistic Manual of Mental Disorders, which is what's used for diagnosing, at least in some places, doesn't mention at all the social aspect of any of the so-called mental disorders. But for most of them, it's huge.
Yeah. So that segues into, one of the reasons we wanted to have this conversation is what we're witnessing of the commodification of mental illness identity and the social contagion among particularly people 15 to 30-year-olds is what I'm seeing is just this real desire to proclaim a mental illness identity and to be acknowledged as being mentally ill. Can you speak on that?
Yeah, I mean, I think that is a real thing, right? Especially this kind of self-diagnosis trend.
Mhm.
And I think there's a couple of threads, and one of them, I mean, none of these are, super, if you've been paying attention, none of this will be a huge surprise, I think. But one of them is the valorization of victimhood and suffering. So in our culture now, having something wrong with you, it makes you more interesting. It makes you a little edgy. It makes you it kind of gives you kind of suffering points or something.
Mhm.
We're at this moment in time where we're being able to claim that you're distressed or oppressed or suffering in some way comes with a certain amount of prestige and cachet. So I think that's part of it. I also think some of it is about belonging. So if you say, I don't know, pick it. I have Tourette's. I'm, what do they call it? I'm a multiple, or I'm a system, or whatever it is, or any of these things. I'm neuroatypical. I'm, on the spectrum. It's. I don't want to say that some of those things don't have legitimacy. I think some of them do. But you also proclaim that you are part of a tribe, and that is so important, especially when you're in that age group.
Yeah, I mean, I think that, one of the things that we're noticing for millennials and for Gen Z, because I don't think that it was common to Gen X and the earlier generations, is that like depression is a mental illness that needs to be diagnosed and treated, anxiety, things like ADHD. And, it feels like we're psychopathologizing the human experience in a lot of ways.
Totally.
And, and I think that, I have to think that some therapists are to blame because some therapists could probably say, what might be helpful is if you changed your life in this way, or you tried, and people always get mad when I say this, but it's true. You tried getting more exercise, try going outside more, like maybe look at what you're eating, maybe look at how much time you're spending online, like these pretty basic things. And instead they're getting prescriptions.
Totally. Absolutely. So some of this is this issue of kind of medicalization, like applying the medical model to just ordinary suffering.
Do you think that there are cases when it's necessary to prescribe medication for mental illnesses or mental health issues?
Yeah, I do. I think medication has its place. I think I have real concerns about lots of things being overprescribed. And I think it's been oversold in many cases. But yeah, I mean, there's a place for it.
I think, having worked as an inpatient psych nurse and doing primary care in a state where that means you're doing a lot of psych care, I think absolutely for psychotic illnesses, for like truly, like people are in a true manic state where they haven't slept for weeks. not this bipolar 2, which I'm not even sure like why we have that diagnosis, but people who are really like psychotic and are not eating or not sleeping, there's a place for those medications. But I think that John Whitaker's work is really important to look at, and Irving Kirsch, of how we don't have any data supporting the use of antidepressants for mild to moderate depression. And we don't have much for severe depression either. They don't work. They make outcomes worse. They often change your brain chemistry in ways that now you have worse problems because we've just disrupted all of your synapses and gotten you addicted to something that's not making you feel better. And you don't have to look to science or studies to see that. We can just look around our culture and see that since the advent of those medications, mental health has gotten far worse in this country, not better. It's in the same way like the medical marijuana didn't make everyone's PTSD go away. More and more people claim to have it, the more weed shops we have. Like these drugs are making collective mental health worse, not better.
Absolutely. Absolutely. And there's something I actually have sort of strong opinions about medical marijuana, at least. And I've been told, about marijuana. I've been told that it's different in the States than in Europe. Some people have sort of reprimanded me for speaking out and not making that clear. But the cannabis that we have in the United States is so strong, and it's kind of being we're people are being told that it's basically medicine, and you can take it, you can enjoy it as much as you want. When really there's a significant correlation between heavy cannabis use and psychosis. Like
really?
permanent. Oh yeah.
Especially in young males. Yeah.
Yes. And I believe, I don't have the data right in front of me, but I believe that psychosis has been kind of exploding. I mean, I talked to some like ER docs and they're like, oh, hell yeah. So yeah, exactly to your point, Mary Lou, like the thing is that we're always looking for the pill. As a culture, we're always looking for the kind of silver bullet. So whether it's going to be like benzos or SSRIs or medical marijuana, or even I have some just some trepidation about psilocybin, not because I don't think it holds promise. I do, and I'm interested in it, but I'm also really wary because it fits the narrative of I'm going to take a substance and that's going to fix me.
Yeah. Yeah, exactly. And that's what a lot of people believe. They're like, I'll go and I'll do this drug, and that's going to cure me. That's going to fix what's wrong with me. That's going to fix my brain. Is psilocybin mushrooms? Does it work? What do you think about it as a form of therapeutic treatment? I want to hear from both of you on this, if you guys have knowledge about it.
Like Lisa, I'm interested in it. I think it has a place. I think anybody who hung out on Dead Tour in the 80s or 90s knows that it doesn't fix all your problems to do psychedelics.
Everybody would be fixed.
I know. It's the thing when people talk about MDMA or ecstasy. I'm like, have you ever been to the rave scene? It's full of cutters and sex perps and people with severe emotional dysregulation. Obviously, the ecstasy didn't fix all of their attachment problems.
Yeah. That's great. Yeah, I mean, absolutely. And I have worked with some people in my practice who used psilocybin and had some pretty profound experiences. And did it sort of magically change things? No, I don't think it did. It sure looks very promising in some of the research that's coming out about kind of end of life anxiety or even PTSD or stuff like that. It's super interesting. Certainly it's a totally different mechanism than any other substance. And I'm curious, and I'm also aware that our culture is going to tend to relate to it in this particular way. Like, oh, that's the answer. The thing about good therapy, I'll say the thing about good therapy is that, so there's the psychologist, Jonathan Shedler. He has a great X, formerly Twitter account. That's really fun to follow. And we had him on our podcast once, and he is known for doing this research on the benefits of psychodynamic therapy. So psychodynamic therapy is any therapy that any therapeutic orientation that believes that there's an unconscious. So that would be like Freudian stuff and the post-Freudians, and it would be Jung and all that stuff too. So the thing about psychodynamic therapy is that it tends to take longer. It's not manualized. Like you're going to come into my office and I'm going to say, where do you want to start? And then you're going to talk about whatever is on your mind. And I'm just going to respond to this in this kind of free floating way. And we'll have a general sense of where you want to go. But it's not like, okay, here's the treatment protocol. In 10 sessions, we're going to get, we're going to assess your anxiety on a Likert scale. And, it's like nothing like that. Right. So he did this research comparing psychodynamic treatment with CBT. And what they found was that both CBT is cognitive behavioral. So that's like manualized treatment that you were talking about before. So both treatment groups benefited about the same amount. And then I might get this a little bit wrong, but after certain follow-up, like let's say 6 months post-treatment, the psychodynamic group had held its benefit. And I think that cognitive behavioral had lessened a little bit. Over time, the people who had psychodynamic treatment continued to get better even years later, even though they weren't still in treatment. And so why is that? Here's what I think is because what a psychodynamic treatment does is it teaches you to develop a reflective capacity so that you're thinking about, you're curious about your own process. You're curious about, oh God, why did I get so mad back there? That kind of thing. So you develop over time like a more fine-tuned appreciation for your own emotional process, which results in that pause between the stimulus and the response. So something happens, you get really angry, but you're used to being like, oh, that's interesting. Why am I getting angry right now? And that pause inserted there gives you a chance to maybe change your behavioral response. So it results in better affect regulation and like a greater ability to sort of think about yourself and understand yourself. So where was I going? There was, I know the point going back to the psilocybin, the point is that kind of stuff is really valuable, but it's hard won and you can't put that in a bottle.
Mm-hmm.
Yeah. I also have been told by a man that, I'm a completely different person now. I've been doing these psilocybin trips and my brain has changed and I'm a whole new man. And these feelings and these reactions are just gone from me. And I don't know. I think that's probably mostly wishful thinking. I'm not going to go so far as to assume that he's outright lying, but I guess I'm wondering what it is that a person might be experiencing that would lead them to believe that psilocybin trips is actually changing them as a person, changing their brain. I guess I'm wondering what's happening there, if anything. And same thing, I mean, medical marijuana, like are therapists prescribing medical marijuana?
Well, therapists can't prescribe unless they're psychiatrists, at least in the
Right.
United States.
Right.
So are therapists suggesting it? Probably some are. I'm not.
No. Having lived through medicalization of cannabis here in New Mexico, it's been just a real interesting trajectory to me as, again, like somebody who came from like the, Grateful Dead adjacent kind of hippie scene, like, and has had a relationship with that plant for a long time. I was excited just to get it legal, and then as a medical provider was happy to help people be legal in it, where it's like, sure, like, show me a woman without PTSD and I'll show you a middle-class white guy was kind of my philosophy of let's just use this loophole to get you legal. So you don't have to worry about having your kids taken away. You don't have to worry about having your car impounded. And then within about a year of what I thought was like playing a game with this, I started realizing people are actually believing they have a diagnosis and this is the medicine for it.
Yeah.
And, and for me, with my kind of more old soul anarchist spirit, I thought we were all just playing a game to get legal, and watching that was really disturbing to me, and that people actually becoming more dependent on cannabis and actually believing this mythology around themselves that I really do have this disorder and this thing outside of myself is necessary to treat it.
Yeah, that's a great phrase. I really like that. This thing outside myself. It's like anytime that you sort of the danger is with the diagnosis and then the treatment, whether or not it's a plant or a drug or a therapist, actually, is that you've kind of given your power over.
Mm-hmm.
Yeah, I think that's one of the biggest things that I'm worried about, is that I think that a lot of people are handing their power over to medication or drugs or even to therapists, where they're like, I'll go to therapy and that'll fix me, or I'll go on these medications and that will fix me. And I think that there's a lot of other things that would be more productive. Even maybe, I mean, I hope that you two can speak to this, but even maybe in terms of trauma. I don't even know what trauma means anymore because it's used very liberally. And I think, I mean, I don't like, how would you deal with trauma? First of all, what is trauma? What actually counts as trauma? What are we talking about when we say trauma? And what I'm asking a lot of questions all at once, but I mean, one of them, I suppose, is like, can you really recover from trauma? Like, I think it's kind of always there, right?
Mary Lou, do you want to go first?
Sorry, that was like 8 questions.
There's I keep thinking in Jungian terms, Lisa. I'm like, I'm going to say this because this is something an ENFP would say, like myself, where I'm really into the world as metaphor, and I really am excited about us all living our personal myths. So there's a podcast I really like called The Emerald that has this. It's all about that we live in mythic times and looking at what we're dealing with here in these mythic times. And he has this incredible episode called Trauma and the Vegetation Gods that I would recommend anyone listen to.
Oh, wow,
and it's about all of the vegetation gods, well, not all of them, but many around the world, and how what we learn from the plant spirits is that you're cut back the whole way to the ground and then you grow back different, but it didn't destroy you. And it's not, as long as you're not attached to wondering what would have happened if that hadn't occurred, this is just your life. This is just your new way of being, and how the vegetation gods all over the world are about dealing with, being cut back, losing limbs, having a year where you can't come up out of your roots because there's no sustenance. And so I'm not really answering your question. I'm just kind of recommending a podcast about.
No, but you're providing a great framing for it, and I think it's so important because basically what you're saying is part of whether or not we recover well from trauma depends on how we frame it. And there were these critical incident stress response. I forget. I think that's what they used to be called. So my first work was as a trauma therapist. I worked with Vietnam vets and the vet centers. And the critical incident stress debriefing, I think it was called. So we were going to be like this part, like there was a plane crash and people from my clinic, we were going to go, I didn't do it, but some of my colleagues did. We're going to go talk to the survivors. And what they found with these critical incident stress debriefings is that people who receive them do worse. Because what you're telling people is something bad happened to you and you should be prepared for you to suffer and have symptoms. There's this idea called social referencing, which refers to childhood, but it's like if you're at the baby play group and your toddler falls down, you're supposed to, the first thing a kid will do when he falls down is look at you, look at mom. and mom is supposed to go, "You're okay." So that then if you do that, supposedly, hypothetically, I don't know if this used to happen to me, but the kid will get up and start playing again. But if you're like, the kid will start crying, right? Because kids look to their parents to read the environment. Well, the truth is we all continue to do that. So if you've just been in a plane crash and you've survived it, and people are like, good for you, here, slap you on the back, and it's like you go on your merry way. But if you bring in a whole bunch of social workers who are like, are you okay? Here's some information about trauma. You're like, oh no, now I'm going to have trauma, right? You kind of create an expectation. So I think your podcast about the vegetation gods is kind of brilliant, because it's like, it's a very different framing. I mean, clearly trauma is a real thing. And to one of your 8 questions, Megan, is what is it? Well, the DSM says that it's when you experience or witness, a life-threatening or you're either something that threatens your life or your bodily integrity, I think is how it's worded. Something like that. I'd have to check. But it's not having your boyfriend break up with you. It's not losing a job. It's not getting stuck in an elevator. I mean, those can be deeply, deeply upsetting things, but they're not technically trauma. And there has been a lot of concept creep around that word.
Yeah, for sure. And I mean, I guess I wonder around the trauma thing, what I mean, one of the things that I want to talk about is resilience.
Right.
I have never been to war. I don't know what that kind of trauma, that PTSD is like. I have experienced abuse, which you could say is traumatic in some ways. But I also feel okay and good. So my perspective is that people can experience, we can have traumatic experiences, we can have experienced abuse. And, I don't want to downplay that and say it's nothing, because it's not nothing. It has a really big impact on your life, but that you can be okay, and
Yeah.
that you can be fine, and you can be happy, and you can have a good life, and you can move on from it. And I worry that people aren't getting that message.
Yeah, I mean, I'm so glad you brought up that word resilience, because as far as I'm concerned, that should be the number one. That should be one of the major goals of therapy, is cultivating resilience. And that does mean that you're met with empathy when you suffer, but that at some point, the therapist also says, okay, now what's the next step? There's also something called post-traumatic growth syndrome. It doesn't, I mean, just like, a certain number of people will go through a horrendous trauma and not have PTSD. I mean, this is the research. And we don't exactly know why some people will suffer PTSD and others won't, even from a similar stimulus. And some people will experience incredible psychological growth. I mean, some of the most resilient, successful people that I have ever worked with saw some of the most horrendous childhood trauma. I'm thinking of one person, I mean, you name it, murder, drugs, sexual abuse, violence, divorce, poverty. I mean, and on. I mean, that's only a partial list. And this person has not been held back by that experience at all. Now, has she had an easy life? Is everything always, just totally honky-dory? No. But it's not, it doesn't, I mean, we know that adverse childhood experiences do generally correlate with worse mental and physical health later in adulthood, but it's also not a one-to-one correlation. And there is this issue of resilience.
I think so much of our lack of resilience is we've lost the things that kept our communities intact and that help people weather the horrific trauma that our ancestors are not very far back dealt
Right.
with, which, right. Like my great grandmother lost 8 children. She had 16
Oh,
children and lost half of them. She lost her first 4 children to fevers when they were all under 6 years old, had 8 more, lost 4 more in a drowning accident later. Like,
oh,
and she went through that, you know, she was known as a happy person. So I think of that in just my line of, and she's not the only crazy story like that. We
oh
all
no.
come from these people.
That's
And
right.
we're the, you know, my generation is probably the first generation to walk the planet to assume I won't lose a child. Like that was a very crazy assumption in the past. You know, it was assumed if you were a mother, you would lose children. So what was different? And so I think about this a lot because I'm really witnessing a lot of lack of resilience in the young people around me and the older people. And I think the hyper individuation that we have now, where before you knew, like, yes, my heart is so broken because my 2-year-old just died of a fever. But my neighbor lost a child last year, and my sister lost a child the year before that. This is a collective human burden that we carry. I think I have a friend who's from Zimbabwe she teaches African dance, and she talks about how you know, in the African cultures that center around dance, the whole community gets together and dances, and they dance the dances of celebration. And they also, you know, every season dance the dance of the grieving mother, all as a group,
Oh
and
my God.
make the movements to express that feeling. So we don't have that. We've lost our church communities, which is used to, whether or not you were a believer, you went to church as part of the social structure of community. We've also lost belief in this, you know,
Yes.
something bigger than our minds.
Yes.
And then these women's crafts that I really think, like, we wouldn't have had to invent things like EMDR if we were still weaving and grinding corn and doing these cross patterning, repetitive, useful material plane tasks that reset the nervous system,
Oh,
for
that's great.
lack of a less reductionist term, you know?
Yeah.
So,
Wow. That's really brilliant. Yeah. That's so interesting. Yeah. I think, you know, you mentioned religion, and, you know, I mean, religion is certainly has been the cause of much, you know, evil and suffering in the world, and frankly continues to be. But it did provide a kind of container and grand narratives and a way of kind of making sense of suffering, and like you said, a containing community around that, and a sort of expectation that you would move forward and recover. And I think that that's huge. And I think there's something about the cultivation of resilience. You know, it isn't, well, I'll tell a story about my dad. So, my dad's a really resilient person. He grew up very poor. You know, by any measure, he's had a great life. But my mom died a number of years ago, and you know, he was devastated. And he made this decision after some time to go into a kind of like assisted living place. It was totally his decision. And he got there, you know, it was a big change. He'd moved out of a big house into this tiny little unit, and like kind of a loss of autonomy in a certain sense. And he called me up after he'd been there for about a week or 10 days. He goes, "Lisa, I think I'm getting depressed." Well, my dad's not depressed. And I was immediately like, "Look, you don't have to stay there. You know, we can, you know, figure something else out." And like maybe another week went by, and I talked to him, and he goes, "I had dinner last night with the most fun, interesting group of women." And then that was it. And he like has been having an amazing time. I like can't get a hold of him because he's always like busy and out, and he learned to play bridge and everything. And at some point I said, "Boy, you're really happy there." He goes, "I decided to be."
Yeah.
He could have decided to be miserable.
Can you speak to that? Because people get so defensive when you suggest that's a choice.
But it is, isn't it? It really is. And I think one of you said earlier, you talked about basically, maybe it was you, Megan. No, I'm it's too late at night. I can't call it back. But it's something basically about acceptance. Like, this is what it is. You know, my dad could feel bitter because he lost his wife, even though, you know, I mean, my mom died in her 80s. It's not like, you know, he could feel the world done him wrong because he's, you know, getting stenosis. But instead, you know, it really is, well, let's see, you know, things have gone pretty well for me, and there's still some good things that I can enjoy, and I'm going to make a choice to enjoy them. So you know, I find it so interesting that just about every man I know is reading Marcus Aurelius Meditations. And I think that is such a good sign, because that is that's kind of the Stoic philosophy. My dad is a good modern Stoic. It's like, well,
Cool.
I you know, you know, it's like, it's sort of one of the things about the anti-resilience culture is that it's anti-reality. It's reality denying. It's like, you know, I'm gonna, I wish it weren't like this. Well, you can wish it weren't like this all you want, but the truth is, it is. As one of my colleagues says on my podcast, reality is medicinal. If you can deal with reality, then you can see what choices you actually have, instead of bemoaning the things you don't have. So I'm probably ranting or rambling or something now, but I think that the thing about the Stoic philosophy is that it is a system of thought that cultivates certain attitudes that result in greater resilience.
Yeah, I think that's a really important thing, the acceptance of reality, and then what can I do to make myself happy and not sort of wallow in this. And you know, one of the things that I was thinking about leading up to this conversation was that wallowing, when it comes in the form of sort of talking things to death, you know, I think that, you know, it can be helpful to talk about things, but maybe for some people it's not helpful to talk about things, and at a certain point you just have to move on and you need to kind of stop talking about it, you know. Like, I don't know, this like going over and over and the obsessing and the analyzing, I don't know how useful that is.
No, well then you're into the realm of rumination, and that's actually not helpful.
Can I ask a question of you, Lisa? Because I need advice. So okay, these are the things I'm hearing again and again in my practice, and I'd like to know where a starting place, where you would come from as a starting place if someone came to you with these statements. One that I hear over and over again is, I have ADHD, anxiety, and OCD, and this is how it manifests. I'm a college student, and my ADHD makes me blow off my work until the last minute, but I have a constant low-grade anxiety that I'm blowing it off, but I'm still blowing it off all the time. And it's not until the very last minute when my OCD kicks in and I get it done. And that's how
Are
I
you
know.
describing me? Did I tell you this? Okay,
Well,
treat me. No.
yeah, no, that's pretty grim. That's pretty grim. Yeah, and that's so pernicious, right? Because it's almost like you have a reason to not deal with what's going on, that you're putting off your work. And I'm not saying that, you know, there might not be, you know, people who are neuroatypical who really do struggle more with executive function. There's definitely room in my worldview for that. But I do worry that some people get this narrative that, oh, well, this is just how it is. So, I mean, I might be interested in working with that person about kind of what's happening when they're procrastinating. Because procrastination is actually an issue with affect regulation, which I think is it's like a huge transdiagnostic thing, right? How we handle emotions. What happens with procrastination is you feel overwhelmed by what you have to do. And so in the short term, it feels really good to say, think I'll watch an hour of Netflix. Like, you make that decision to not work on your biology project and to watch Netflix instead, and you immediately get a little, squirt of dopamine because you've just, made this pleasurable decision. And then when that hour is over, though, you're confronted again with, oh shit, I haven't started my biology project. And oh wow, I think I'll watch another hour, So it's an affect regulation issue. And I might, that obviously in the short term it feels good, but in the medium to long term it does not work very well. And so I might be curious, instead of like saying I have ADHD and that's why I can't do it, is a little bit of what I sometimes call like a stuck story. Like, there isn't any curiosity about what's going on. I mean, maybe it is quote unquote ADHD, but you could still be curious about it. What is your process? And that's that reflective functioning that I was talking about before. That can you notice when is the first impulse you have to turn away from doing your work? What's going on? How are you feeling? What are you feeling in your body? What's the self-talk that's going on at that moment? Can you start to notice yourself? Can you get curious about your own process? So I might try to get up under it, instead of, there's just like this flat narrative. I have ADHD and then I have OCD, and it's like, maybe we don't have to just accept that as this kind of black and white narrative.
Well, and when you tell yourself those things, then you can't change it. And
That's right.
I mean, the reality is that, like, I've always had a problem with procrastination also. And I think, you just realize at a certain point that
oh no,
I know, it's frozen.
Right as we talked about procrastination.
I know, it's fascinating from a metaphorical perspective. Yeah. I would love to see somebody write an analysis of these times, of just what are we expressing here. I'm thinking of like Jung's that essay on belief in extraterrestrials.
Yes.
Yeah. And to see that someone really do a good analysis of the medicalization of all of human life and the cult of reductionism. And she's gone.
Yeah. Well, in some sense, I think it's this sort of, we've made like technology and science a god. So, so that like science will save us and medicine will save us and that sort of thing.
Absolutely. Yeah.
Sorry,
there she
guys.
is.
I
Yay.
didn't realize my laptop wasn't plugged in. Yeah.
You procrastinated plugging your laptop in.
Well, it appears to be plugged in, but it wasn't plugged in. But yeah, like, I mean, it makes things worse, and it makes things more stressful when you procrastinate. And it's also, I mean, I kind of chalk this up to maturity in a lot of ways. And it's also like, you need to do hard things. Like, I don't want to do this. This isn't very fun. This is a hard thing to do, but you have to just do it and get it over with. And I think, I'm a bit driven mad by these diagnoses, especially when you're telling kids, because the kids are just going to be like, oh, I have ADHD, so this is my problem and there's nothing I can do about it, when in reality there's lots that you can do about it.
Yeah.
I know you have to get going. I want to ask one more question before you leave, because I titled this stream Therapy, the Good, the Bad, and the Grift. Do you think that there's a form of therapy that's a grift? I was thinking a little bit about Instagram therapists, who I think are pretty much all bad. I hope I'm not insulting anybody I know. But it's just like, like I get all these, obviously, because I'm so interested in narcissism. I get all these in my Discover, in my algorithm on Instagram. I'm always getting these slides and these like 30-second clips of a woman therapist, often sometimes a man, describing, this is what a therapist will do. Like, this is how you respond to a therapist. This is how you recognize, a narcissist. Recognize a narcissist. This is, what, this is what a narcissist will say to you in this circumstance. And it's like, it's just not that simple at all. Like, I don't know, you kind of, that's sort of one of those things that unfortunately you need to experience. But yeah.
Well, I mean, I guess I would say that, first of all, of course, there are sort of bad people out there, but I think the majority of people who are drawn to the therapy profession are, we're nice people, and we like people, and we care about people, and, sometimes to a fault. So I don't think most people in the space who are bad because they're malicious. But I do think there's something about social media and even just our current culture these days that really rewards a certain kind of truculent certainty. Like, like you're saying, Megan, like, this is what a narcissist is. I'm going to tell you. And, that gets a lot of that gets a lot of attention on social media, that kind of, that sort of shrillness. But I would say that it's probably good to be a little bit circumspect when anyone seems too certain about anything.
Totally.
Especially when it relates to the psyche.
Yeah, oversimplifying. This is how it is. This is what you do. This is the hard truth. I think you're right. People love that kind of thing online. Those kinds of posts do really well, but they're not actually the truth often.
Yeah. And it might be that some people are in that social media mill. So when you say about the grift, like, do some people get caught in that?
Yeah.
Like, I'm going to keep on doing it for the likes and try to build a career this way. Yeah, probably some people do.
And I have to stay in the algorithm, and to stay in the algorithm, I have to keep pumping these things out. And
yeah.
Anyway, I know you have to get going. Is there anything you want to add before we end, Mary Lou?
No, I'm just thrilled to have had this conversation. It's wonderful. So thank you for joining us, Lisa.
Yeah, thanks. It was really great meeting you, Mary Lou.
So much,
you
Lisa.
too.
Yeah.
And thank you, Mary Lou, as always. Your input was really so interesting and cool. And yeah, Lisa's podcast, for everyone watching, is that Jungian Life. Did I get that right?
This Jungian Life.
Okay. And lisamarchiano.com is your website. Your new book, which I'm so excited to read, is called The Vital Spark. And where can people find it?
So if you go to my website, lisamarchiano.com, you can find out more about the book. I think you can get a free excerpt, and there are links, purchase links, but you can find it wherever books are sold.
Perfect. Okay. Well, thank you both so much. But yeah, Mary Lou's website info is also down in the show notes, enchantedfamilymedicine.com. And she's also on Substack. And we will be back with our weekly live stream. Where Are All the Women? We're all here on Wednesdays, usually at 8 p.m. Eastern. God, I'm trying to do I'm in a different time zone now, and it's throwing me off. It's always 7 p.m. Central my time, and then 8 p.m. Eastern. So we'll be back next week. And thank you so much for everyone who tuned in and participated in the live chat. It was a really fun and interesting conversation.
Great. Take care. Thanks.
Okay, good night. Bye.
Good night, everybody.